Welcome back to the Morning Blend. Well, do you have pain and swelling in your hands? A lot of people do. In fact, Harvard's medical school says 1 out of every 3 adults will have arthritis as they grow older. And get this, baby boomers have arthritis way more than even their parents' generation. Arthritis in the hands, as you can see in that x-ray, can cause a lot of problems, especially with mobility.
Yeah, Dr. Crimmins is back from Hand Surgery Ltd. to talk more about arthritis in the hands. Hi, Doctor.
Good morning.
Nice to have you back.
Thanks for being here.
Thank
This
you.
time of year and just in general, how common is arthritis in the hands?
Well, it's common all the time, of course, but at this time of the year, the weather changes, and you know, they're doing more things occasionally, and they do come in a lot, and also in the winter, we as physicians, we seem to see it more because it's not summertime. They think this is the time to have something checked. This knuckle's been bothering me for a long time, and so at least we think it's more common now, but it may not be just because they like to come in during the winter.
Is the most common place for arthritis in the hands?
It could be just because there's so many joints, but there's certainly areas in the hand that we see so commonly, and it's almost, for many of the types that I treat, it's almost a condition of aging. And so, you know, the base of the thumb, the tips of the fingers, almost everybody has some at some point in their life.
What are some of the symptoms that people would be experiencing, especially this time of year?
Yeah, well, for the most part, at the base of the thumb, it's when you're pinching things, when you're grabbing things. Because when you're grabbing onto something,
And point on your hand while your hand is kind of up there where they would really feel it.
I mean, this is just right at the very base of the thumb. That's an exceedingly common spot in the hand, probably the most common disabling area that we find. And it's because you're always holding on to something. Anytime you pinch, you turn a car key, a common thing, opening a jar in the kitchen, you know, lifting anything heavy. I mean, those symptoms come out and people will come in, their hand is bothering them. They don't think that it's arthritis. They think it's tendonitis because you think arthritic knee, arthritic shoulder, arthritic hip, something like that, or neck. But all of a sudden, I look at their thumb and I can see it from a long ways away. And that's the problem.
How do you sort things out when somebody thinks maybe they have carpal tunnel or some sort of repetitive motion problem? How do you know the difference between something like that and arthritis?
Well, it's totally different, actually. I mean, carpal tunnel, really, it's a nerve problem. A nerve that comes into your hand doesn't have enough room, and the symptoms are numbness in your fingertips, particularly when you sleep at night. It might be as simple as that. When someone comes into the office and they say, I was sleeping last night, my fingers were tingling, well, that's not arthritis. That's not a pain condition. It's more of a numbness condition. Arthritic conditions are painful conditions. It's either a reduction in mobility of a joint or it's pain in the joint, but it's primarily pain. People will tolerate a stiff joint where it doesn't move very well, but once it starts having pain, it disables them, and then they're in.
And you mentioned reduction in mobility and pain. Is there also an increase in, or a decrease rather, in strength in the hand very often?
Yeah, because pain is kind of, it affects your strength, and patients come in and say, I think my muscles are bad, and they go, no, the muscles that help you grip are in your forearm. There's nothing wrong with those. But when you have pain in a joint, when you squeeze something, it hurts and you kind of stop. And so when I hear about weakness, I think about arthritic changes first.
So when we talk about doing some of those things, is it the activities or the repeated motions that cause it, or are some families more prone to? Is it genetic? Who's
It's mostly genetic. It's aging. I mean, some of the joints in our hands are more susceptible to changes. It's probably not so much repetitive motion because there's lots of people that are super active and don't have any arthritis. There's other people that aren't exactly working demanding manual labor jobs that get it. So we see it across the entire population. But it's a condition of aging. The older you get, the more changes you have.
What about obesity? Is that a risk factor, or does that tend to exacerbate problems with arthritis?
Probably not so much in the hands because they're not as much of a weight-bearing joint. The knees and hips, certainly, that would be different. But in the hands, it probably plays less of a role.
And what do you do to treat it? You know, if somebody's saying, oh my gosh, these are exactly the symptoms I'm having, how can you make it better?
Well, the end answer is that we fix it with surgery. But well before that, for months and months and years, and depending on the symptoms, we do all the simple things. If it hurts, don't do it. So you can eliminate some activities, but most of us don't have activities in our life that we can eliminate. Like I can't stop doing hand surgery.
Or opening a jar.
Or opening a jar. Or turning my
writing
car
a
key.
letter.
Right, exactly that. We think exercising helps a little bit, keeping the joint mobile, not so much overusing it. We'll give patients splints. So if there's one joint that's painful, we can hold it still, and they can be much more active with that joint being held still. Anti-inflammatory medications help many people for all their joints. We do steroid injection on occasion. That doesn't fix the problem, but cools down the inflammation for a while, and used judiciously, that's a good treatment.
I think the key here is seeing a professional, you know, being able to talk it out with someone, have you really listen to the symptoms, take a look at the hand, figure out what's really going on with your symptoms. So here's the information for Hand Surgery Limited. You can contact Dr. Crimmins or any of the other wonderful doctors there at 414-453-7418 or visit them online at handsurgeryltd.com. Thanks for being here, doctor.
It was my pleasure.
Nice to have you back.
Thanks for having me.
Up next on the show, a medical doctor is here to explain the